साई मेरा मैं तेरा, ये प्रेम की बहती धारा, मेरा साई प्रसन्न होगा, मेरा साई प्रसन्न होगा। दिन दुखियों से प्रेम करो, मेरा साई प्रसन्न होगा।
Sai Ram. Those lines from a popular bhajan clearly state that if we serve and love those who are in pain, those who are suffering, those who are forlorn and weak, then my Sai will be happy. I am sure that our Swami had the broadest smile on his face as a dedicated team of doctors and volunteers from different countries of the Sri Sathya Sai International Organization, namely Botswana, Kenya, New Zealand, the United Arab Emirates and the United States of America, traveled to the countries of Nigeria and Benin in order to render service. Here, there is a difference in the definition of service. This dedicated team went there not with the idea that we are helping someone, but they were so pained and affected seeing the need in these countries, they traveled there in order to ease themselves of that pain. That is why, despite multiple challenges that included bad health, that included logistics, troubles in getting the visa, they overcame all of that, spent their own money, their own time, their own resources, and made this journey to make Swami happy. The first medical camp was held at the Sathya Sai Nursery and Primary School at Aja, a town in Etiosa in Lagos State, Nigeria, from the 9th to the 10th of June 2023. Now, though the camp was not formally advertised anywhere, patients arrived in droves. It just showed the urgency of the healthcare needs in this place. Free medicines and reading glasses were dispensed to patients, and seeing them rejoice at the gift of sight was so heartwarming for all the doctors and volunteers.
Hare Krishna, Hare Ram, Sai Ram, Sai Ram, Gopa Govinda Bolo Jai Sai Ram, Madhava Mukunda Bolo Jai Sai Ram, Jai Jai Ram, Sai Ram, Jai Jai Ram.
Both adults and children were treated for a host of other medical conditions also, and these included diabetes, hypertension, malaria, skin infections, respiratory infections, pelvic inflammatory disease, anemia, musculoskeletal syndromes, osteoarthritis, gastrointestinal conditions, rickets, cerebral palsy, neuromuscular disorders, malnutrition, and several others. It was heart-rending to see a 10-year-old with a cataract since birth, a 3-year-old with an inguinal hernia, and a 13-year-old with severe anemia. Such cases, which were beyond the scope of immediate treatment, were referred for further consultation. The local SSSIO members and doctors were asked to follow up diligently on the progress. The dedicated team served a total of a whopping 1,026 patients on these 2 days. On the 11th of June 2023, the SSSIO international team had to travel from Lagos to Benin. Now, Benin ranks among the poorest countries in the world, and yet economic problems aren't the biggest challenges that it faces. There is a great need for medical care and medical aid. And therefore, as this team traveled 250 kilometers in a journey spanning more than 8 hours, they landed at the Benin border. It is with this grace, gratitude and joy of Sai in their hearts that the enthused team reached Abomey in Benin. Now, Abomey is a UNESCO World Heritage Site, for it has the royal houses of Abomey. This was the home of the royal family, the kings of Dahomey, for more than 3 centuries, and the team indeed got a royal welcome because the king himself was there to welcome them and express his gratitude to them for having ventured on this noble initiative. It was nearly 9 p.m. when the team actually reached Abomey in Benin. The team then visited the local Sai Center and witnessed a miracle. The premises were packed even at the late hour, and it was overflowing with local African devotees who had gathered with love and enthusiasm to welcome them. It was amazing for the team to discover that there are more than 1,000 local Sai devotees in the Abomey region. And Mr. Jacques Fego, the National Council President for the SSSIO in Benin, is the inspiration behind every aspect of service in the community. Witnessing his passion and commitment to serving his community, especially the school children and the families, it was awe-inspiring for everyone. Even though it was late at night, the SSE children chanted Vedas, recited prayers, initiated a Havan as well, a ritualistic religious offering, and finally concluded with Aarti to Swami. The next day, the medical camp began. Right from 5 a.m. in the morning, patients began queuing up for consultations. They came in large numbers, which again spoke about their desperate healthcare needs. You see, it was not just about medicine. The loving interactions, the doctor listening to their pains, sharing a smile, all of these brought more than just cure. It was healing for both doctor and patient, and it was healing at the heart. The SSSIO medical team lovingly served nearly 1,500 patients between June 12th and 15th. But thousands of hearts more were touched in hundreds of other ways. The service rendered by the dedicated doctors just cannot be described in words or a documentary. They were literally miracle workers for hundreds of patients who expressed their deepest gratitude to them. The interesting thing is, the consultations were all held in nature under the shade of trees. Despite it being the monsoon season, it was Swami's grace that not a single drop of rain impeded the medical camps throughout the 3 days. On completion, as the final group pictures were taken, the heavens opened up. It was as if nature was celebrating the love and service with a downpour. It was an incredible experience, confirming Swami's love and protection at every level. Throughout the days of the medical camp, the local devotees served food to the patients, chanting Vedas and singing bhajans. On the 16th of June, a workshop titled Happiness Within Reach, EASE, was conducted in one of the high schools in Abomey to teach holistic health. 59 students and 4 teachers attended the workshop. The Benin community is poor and cannot afford ongoing medicines for chronic conditions. This is because medicines are prohibitively expensive compared to the rates in other countries. Therefore, the SSSIO has initiated efforts to support this community with free antihypertensive medications via ongoing clinics which are supported by the local Sai centers. The medical team also met the public health director and discussed common prevalent diseases and their prevention. The team suggested providing mosquito nets to the public to prevent malaria rather than spending money on anti-malarial medication. The suggestions were all well received, and even the mayor was in all praise for the selfless service done. Dear brothers and sisters, It is natural to understand that the patients felt great joy, thrill, gratitude and satisfaction with the medical camps that were held in these two countries. But what I found amazing was the gratitude, joy, thrill that the doctors exhibited and exuded having completed this service. So amazing is this joy of seva. So fantastic is this happiness and satisfaction of serving. That is when I got this thought. Kulashekara Alvar, a great saint poet from Tamil Nadu in India, says, "Oh Lord, if I am not able to serve you, give me the opportunity to serve your servant. If not that, let me get the chance to serve the servant of your servant of your servant, and servant of your servant 7 times.